Welcome to BCRF Zoom. I'm Margaret Flowers, Director of the Research Program, and I'm thrilled to be joined today by Dr. Laurie Pierce, a BCRF investigator and researcher at the University of Michigan. We've asked Dr. Pierce to join us today to talk to us about the successes and persistent challenges in achieving health equity in cancer care, as well as some of the challenges in achieving the workforce that representative workforce to achieve some of those goals in health equity. And Dr. Pierce, I want to thank you for joining us today and taking time out of your very busy schedule. And congratulations as this year's president of the American Society for Clinical Oncology, or ASCO. I'd like to begin by just asking you to introduce yourself and tell us a little bit about your research.
Well, I'm very happy to be talking with you, Margaret. I'm Laurie Pierce. I'm a radiation oncologist at the University of Michigan. And as you said, I'm very honored to be the president of ASCO. And I have been fortunate to have been funded by BCRF for so many years. And the nature of our work has been primarily to look at cancers that are resistant to radiation. You know, we know the vast majority of women with early stage breast cancer are treated extremely well with lumpectomy and radiation. But we know there are about 10% of women that even with standard treatment have resistant cancers. And so we've been focusing on that through the funding of BCRF through the years to look at radiation sensitizers that will allow us to have greater tumor kill and still have the normal tissue to tolerate the treatment well. So we've looked at uses of chemotherapy as sensitizers, we've looked at PARP inhibitors, we've looked at inhibitors to androgen receptors. We looked at various factors to figure out those agents that will sensitize these tumors to radiation.
So I know you've had a long-term history or interest in health equity.
Yeah.
How have you incorporated that interest into your own research?
So it's a great question. So with the work that we've done, looking at radiation sensitizers, that's work that will help all patients that have biologically resistant cancers. That said, there are certain agents, such as the inhibitors that block the androgen receptor, that may disproportionately help women of color, because we know that women of color have a higher risk of having triple-negative breast cancer. And being able to block the androgen receptor, which is in all cancers, including triple negatives, could potentially disproportionately help our women of color. But that said, again, these types of research programs help all patients. And I've often said to my residents that cancer cells can't tell what color you are, right? We give them far too much credit. They do not know what color we are. They function by the biology of the cancer. And so if you can understand that biology, you can then overcome that biology. Because conversely, there are many African-American women who have indolent disease. And so it really boils down to what the biology of the cancer really is. So from the BCRF standpoint, we've really focused on biology. Where I think race comes in is more in the socioeconomic issues, where race almost becomes a surrogate for socioeconomic and poorer patients. And so some of my other research is really focused on that aspect. You know, looking at, for instance, hypofractionated radiation. We know from many trials that shorter courses of radiation are as effective as the longer courses, but they are more cost effective, they're more convenient, they have less side effects, and they are in many ways, for many women, preferred over the standard treatment. I published a paper, oh my gosh, I'm dating myself, maybe back in '92, I think it was, showing that breast conservation was an excellent option in women of color, which of course now seems so obvious. But back then, there were a lot of women of color who were not being offered breast conservation. So I felt I had to publish the obvious. And I think my paper was the first paper that looked at that. Now we fast forward to hypofractionation. We want to make sure that, yes, women are getting radiation and they're getting shorter courses if it's appropriate for their types of tumor. And so we did a study that was just published a couple of months ago, looking at the rates of hypofractionation, and they were significantly less in women of color. So here we go again. And we found that if you corrected for the institution where they were treated, then there were no differences. So that would suggest that there are more people of color going to institutions that are not actively using hypofractionation. So it's a reminder to us all to offer the best therapies to all of our patients. There should be no difference based on this. So it's a long answer to your short question, but I think you have to consider biology, you have to consider socioeconomic differences to really get at the heart of these issues.
When you chose your theme as president of your theme for your presidential year at ASCO, equity, every patient, every day, everywhere, was before the COVID pandemic hit. It was before the mass demonstrations against racial injustice took place across the country and the world. Have these events informed or affected your goals as president of ASCO?
Yes, the short answer is yes. Health equity has always been very important to me. As an African American, I've been acutely aware of the health disparities for people of color in just about any endpoint, and certainly as a cancer doctor, in almost any tumor you look at, there are worse outcomes for people of color. So that has stayed with me through the years. So when I was fortunate enough to be elected president of ASCO, early on I knew I was going to pick an equity theme. And then, as you said, later came the pandemic that disproportionately affected people of color. They're typically the essential workers. They're not people who have the option of working from home, and they're out in the front lines, and they often have comorbidities, and so they have been disproportionately affected. And then came the very public displays of racism. And we know racism is not new, but it's much more visible now because we have cell phones, we have internet, we have ways to be able to see things that were not widely seen before. And these things rock the world. And they cause everyone to say, enough is enough, and there must be change. And I'm cautiously optimistic there will be change. So yes, all that factored into my goals. And before I talk about my goals, I want to make sure I make the point. ASCO has been doing a lot for many years for equity. That is at the very heart of what ASCO does, health equity, and trying to make sure that everyone has access to high quality care is the very foundation of ASCO. So my role as president in promoting my theme is, first of all, to make a lot of the programs that are in place much more visible. Because ASCO is such a large organization, I think a lot of people don't realize so much of what ASCO does. So one of it is to make it more visible, but then to also augment what ASCO is doing with other programs. And one of the programs that I am very excited about, we actually just had our first meeting yesterday, is trying to improve the enrollment of underrepresented minorities on clinical trials. We know, I'm preaching to the choir here, that clinical trials are the way to overcome our cancers, both patients and future patients, by offering the best possible care on clinical trials and by being able to test new agents that will then be pivotal in curing cancers in the future. And we know that despite that, there are low numbers of minorities on clinical trials. If you look at the numbers, and I was just talking about this yesterday, Hispanics and African Americans make up about 3 to 6% of patients on clinical trials, whereas they make up about 13 to 15% of patients with cancer. So there's clearly a disconnect between the number of percentage of patients on clinical trials who are underrepresented and the percentage of patients who get cancer. So there's much work to be done. And so long story short, ASCO is now partnering with ACCC, the Association of Community Cancer Centers, that the president is Randy Oyer. He became president in March, and his focus has been, for his presidency, was to increase the community in helping to put patients on clinical trials. My focus has been equity, and Dr. Cliff Hudis, who we all know so well, talked to Randy, heard what his focus was, knew what my focus was, and said, you know, you two may want to talk to one another. And then he told Randy, and Randy and I began to talk with one another, and we are now working together, bringing the two organizations together in an initiative to improve enrollment of underrepresented minorities. So I'm really excited about that. We have a steering group that we just met for the first time yesterday of just amazing people whose careers have really focused on this issue and who have made significant strides in their own right. And we have sent out an RFI, request for ideas, to the ASCO and ACCC communities for those who also been thinking about these issues, for strategies, for proposals that we can implement and do them more broadly. It's interesting. I could talk about this forever, and I won't because I know we don't have much time, but it's interesting. If you look at the literature, you will see incredible experiences where people have used various strategies and they have been successful at this. But they're spotted in the literature. We know that if you look at the trials in general, as I just mentioned, that underrepresented minorities are not appropriately represented on our trials. So what we need to do is look at some of these strategies, figure out the strategies that are optimal, and then bring that broadly to the cancer community. There are ways to do this. There are absolutely ways to do this. And others have tried previously, and as I said, had some improvement, but not enough. So I'm hoping collectively that we can move this forward. So it's an initiative that we're starting to work on. The RFI is out there. The deadline for sending in proposals is later on this month. I think it's the 24th of August. And then our steering committee, between the proposals we get in addition to the ideas that they themselves have, in addition to reviewing the literature, we will come forward with some proposals that we will then try out broadly starting in 2021. So I'm very excited about that. As you can tell by the length of my answer, I'm very excited because I think we can move the needle forward. I think it's very important. So that's one initiative. So then another initiative is trying to understand the relevance, the importance of social determinants of health for our cancer patients. We know social determinants of health basically determine everything. They are the circumstances under which we're born, where we live, where we work. Everything about our lives has to do with social determinants of health, and it has to focuses on power and money. And I don't think we as physicians think enough about the things that our patients must face, the barriers they go through, and how that affects their ability to be treated for cancer. And so we want to bring an awareness to the social determinants of health, and we're focusing primarily on oncology fellows and early career faculty, kind of our leaders of tomorrow. And we are putting together what will be a series of podcasts focusing on social determinants of health. And in the planning of this, we've actually got a focus group of fellows and early career faculty that I believe we're due to have our first meeting in a couple of weeks to get their thoughts on how best do they learn, what topics do they want us to cover, and collectively we will come up with a series of podcasts. I would envision that the first podcast would be a basic 101 on social determinants of health. An idea that came from our health equities group is how to take a social determinants of health history. And I love that, to ask the questions about transportation, about financial toxicities, to understand the barriers that our patients face. Because we as oncologists, we have all these wonderful, wonderful advances. But if patients can't come and get that, if they have to work, they don't have transportation or whatever, all this is for naught. And we don't know what our patients face. Well, we need to know. So I think taking a history, I can envision one of the podcasts will be on obesity and energy balance. Another would be on financial toxicities. We're going to work with our advisors who are fellows and early career faculty and set up a series of podcasts. And this will be an enduring resource that can be used for the future. So I'm very excited about that as well. Another piece, and this is there's like layers of an onion. This is a complicated thing, so you need to come at it from many perspectives. Another is trying to enrich even more the workforce in terms of people of color. And ASCO already has in place programs for medical students of color. There's stipends that they can be paired with a mentor, and they can then also come to the annual meeting. So helping them to become aware of oncology early in their medical career. Well, we also have that for residents, for fellows, residents, excuse me, as well, so that they also, before they have to determine they're going to go into oncology, will have a better appreciation of what oncology is all about. We're going to expand that even more. And I don't want to get into too many specifics, but I can tell you there will be a program that the infrastructure will be set up during my year, and it will be carried out the following year, where there'll be more concentrated experiences for underrepresented medical students in oncology, so they have a very, very good feel for what our field has to offer. You know, if you look at the data, there was a paper that was published in 2019 looking at internal medicine residents and the fellowships they chose to go into. Oncology was at the bottom. That is just not acceptable, because it means that they don't know all of the things oncologists do. They don't know all of the different areas of how they can impact patients' lives. And so I think it's up to us to make it even clearer to our trainees of what a wonderful field oncology is. So ASCO will be working on that as well. I personally, I'm committed to bring more minorities on committees in ASCO, because I know that that is how you ascend the ladder and how your voices are heard. And so we are focusing on making sure that we have more diverse members, females and underrepresented minorities on our committees. Embed the whole idea of equity within our annual meeting. And others have told me they've tried and have been unsuccessful. And they'll say, Lori, you're not going to be successful. Well, that's not acceptable to me. There are ways, I'm convinced, to be able to embed equity into our themes. And because what we've typically done is we've had certain sessions set out for equity. And quite honestly, they haven't been attended well. And I don't think that's because people aren't interested. I think it's because there's so many things in ASCO going on, you can't cover everything at the same time. And equity tends to get pushed at the bottom. Okay, I understand that. So then we have to bring equity to the masses. There are ways that I think, either through discussants or clearly making clear to presenters, that equity needs to be a focus in the presentation. So we are going to give that another try, and I'm hoping, as being president, that I can push that agenda forward.